When I saw this question, I just about freaked out. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 304, and today I want to talk to you guys about a question that is posed inside of the world of hearing care about what particular hearing aid brand your hearing care professional should be recommending to you. But before I get into this vlog, guys, do me a huge favor, click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. Okay, so what actually prompted today's vlog? Well, there was a question posed inside of a professional audiology forum, and it was either posted by an audiologist or a hearing instrument specialist. I'm not really sure. I don't know the individual personally, but it was actually a pretty good question. The question was basically, I have a patient, new patient in my clinic. They've been wearing hearing aids for decades, and they've typically worn brand number A. Okay, I'm not going to tell you the actual brand, but brand A. But I am more familiar with brand B inside of my clinic. That's primarily the devices that I dispense. I keep them in stock, so it would be an easy transition over to fit them with this brand of hearing aid that I'm most familiar with. But that being said, this is actually a legitimate question that I have to answer every single day inside of my clinic when someone comes in with hearing aids that I did not initially fit them with, and if I think that there's a different brand that they could do better with. So we have to parse out a couple of different things here. Number one, is there potential bias in this? Well, if there is, that's a problem, okay? You should never just pivot someone from the brand of hearing aid they're most familiar with or the brand of hearing aid that actually makes the most sense for them just to get them onto a brand of hearing aid that you're most familiar with inside of the clinic, or that you might get better pricing on, or that you might just have in stock and you can quickly fit this individual with these hearing aids. But assuming that this question is coming from a moral place, meaning they actually want to do what's best for the patient, you have to move on to question number two, which is this individual likely going to do better with a hearing aid that they are most familiar with? So there's a thing inside of the world of hearing care to where when someone gets used to the sound quality of a particular brand of hearing aids, that it typically makes sense to keep them in that brand of hearing aid unless there's a very specific reason to pull them out of that hearing aid brand. So if an individual absolutely loves their hearing aids, it wouldn't make a whole lot of sense to pivot them into a completely different brand because they're already used to the one that they like. Now, there is something to be said for trying a different brand of hearing aid on an individual because they don't know what they don't know. You might switch them to an entirely different brand and they're like, oh my gosh, this is the greatest thing ever. I wish I could have been hearing this way for the past 20 years. So if this individual got upgraded to the newest hearing aid with brand A, they might do just as good as they would with a brand new hearing aid from brand B. However, you do have to answer this third question, which is, are there certain features and customizations available inside of a different hearing aid that make more sense for this individual? For instance, if there are wireless accessories that an individual needs to be able to use to maximize their performance in a background noise situation, you might want to pivot them from brand A to brand B or brand C, depending on the availability of those accessories. There are also different features inside of different brands of hearing aids that might make more sense for certain individuals than others. And so if you identify that a different brand actually makes more sense, you should probably pivot that person into that other brand, and of course have an open discussion about this with the patient. But you have to be able to answer the fourth question here, which is your familiarity with the brand of hearing aid that they're using as good as the brand of hearing aid that you're most familiar with? Let me give you an example. So oftentimes we have patients come into our clinic and they already have brand new hearing aids that they got within the past couple months. And why did they get those hearing aids? Well, they heard me talking nice things about those hearing aids in my YouTube videos. They go to a hearing care professional and they say, hey, Dr. Cliff said that this is the best hearing aid, you gotta get me that hearing aid. And the hearing care professional's like, well, if that's the hearing aid that you want, then that's the hearing aid that I'm going to order for you. The problem is, that hearing care professional is not experienced in actually fitting those devices. It would actually be better for that hearing care professional to recommend the brand or brands of hearing aids that they are most comfortable optimizing, rather than offering the patient the brand that they requested and having no freaking clue how to program it correctly. And I see this all the time inside of my clinic. So if we go back to the original question at hand here, which is, should I keep the patient in brand A that they've already been wearing, or should I switch them into brand B? You really have to find out all the answers to these questions. If you are going to recommend brand B just because that's the brand that you work with and everybody needs to wear that brand of hearing aid if they're going to come to you in your clinic, probably not a good fit for that particular patient. However, if it legitimately makes more sense to get someone off of the brand that they've been using into a different brand because that brand would be better for them, it has the right features for them, or you know how to optimize it better, then it probably makes sense to pivot them out of that brand. And if you truly do not feel like you can help them hear their absolute best by switching them into a different brand of hearing aid, then as a hearing care professional, you should be referring that patient to a different clinic that specializes in working with brand A in this case. Fortunately, at the end of the day, the person who posed this question in this professional forum elected to keep the patient in brand number A because they had familiarity with this brand. They knew how to optimize it, so they did not feel that they had to pivot them over to brand B that the clinic sells more of. Personally, I think that this was the right decision because every decision that we make should be right for the patient, not necessarily for ourselves. But I want to know what you think. Do you think that it's a good idea for a hearing care professional to make a recommendation based on what they're most comfortable with, or do you think they should be making a recommendation based on what's best for the patient? Let me know down in the comment section, and I'll see you in the next video.